Welcome to the Beef Roundtable. I'm Dr. Ron Lemonager, professor and beef extension specialist at Purdue University in West Lafayette, Indiana. And I'll be working with my co-host, Burt Rutherford.
And I'm Burt Rutherford, senior editor of Beef Magazine. I'm based in Amarillo, Texas. Each month, we're going to discuss timely topics that impact the beef industry.
The Beef Roundtable is recorded live and edited to fit the time constraints of the program. The programs are available at Beef Magazine website, iTunes, YouTube.com, as well as www.beefroundtable.com.
The use of antibiotics in the livestock industry has been a topic of discussion in the media because of the potential for antibiotic residues in animal products and antibiotic-resistant organisms that could impact the ability of the medical community to treat human diseases.
We have two guests with us today to discuss the issues surrounding the use of antibiotics in the beef industry. Our first guest is Kristina Butts, Executive Director of Legislative Affairs for the National Cattlemen's Beef Association, and she joins us from Washington, D.C.
And our second guest is Dr. Mike Apley, Professor of Production Medicine and Clinical Pharmacology from Kansas State University and a Beef Magazine Vet's Opinion columnist. He joins us today from Manhattan, Kansas.
Dr. Apley, so let's begin our discussion by defining the term antibiotic resistance and what it means to consumers.
Antibiotic resistance to consumers most likely means that if they or a family member has an infection and goes to the doctor is unable to satisfactorily treat that infection with an antibiotic. And this may require escalating to more important antibiotics, ones with more side effects, or in some extreme cases in human medicine, there have been cases where it was essentially untreatable. Now, antibiotic resistance happens when an organism has a resistance gene, just like we have genes. They have a gene that encodes for resistance, and antibiotic selection pressure brings that up more and more in the population until there's more of those bacteria with that resistance gene. The question is, do antibiotics used in food animals have an effect on the ability to treat infections in humans? This is what is bringing about all of the debates, a lot of the regulatory activity, legislative activity today. And I can tell you that it is far from a resolved issue. In my opinion, yes, there can be some relationship, but the relationship of food animal antimicrobial use to resistance in human infections is a very small piece of the overall challenge of resistance in humans.
Kristina, antibiotic resistance is certainly not a new issue. So from NCBA's perspective, how has the beef industry addressed this issue historically? And what are the implications at the policy and legislative side of the antibiotic issue?
When you look at it from more of the trade association standpoint and the members that NCBA represents, for more than 10 years, we've actually had a chief veterinarian on staff here in Washington. And the primary focus of that position and that individual has been to be engaged in all conversations around the use of antibiotics in food animal production, specific to cattle, but then also be involved in multiple conversations here domestically about antibiotic resistance because it is multifaceted. There is a focus for the human use of antibiotics, the companion animal use of antibiotics, and the food animal uses of antibiotics. But then also internationally, being very engaged and active in other organizations like Codex or the OIE, two international organizations that also talk about antibiotic resistance and finding ways to really kind of better address the issue wholeheartedly. And when you start looking at Washington, D.C., there's lots of conversations happening here, whether that might be at the White House. They recently held a meeting back in June. Dr. Mike Apley actually came to Washington and represented NCBA's membership in an official capacity at that meeting. Then you also look at Capitol Hill, where this has really been a topic of interest for about the last 10 years with several members of Congress. And then recently talking about the Food and Drug Administration and many of the guidance documents that they've put forward that will be in effect in 2016. So really, it's a conversation that the beef industry has been very involved with for multiple years. Right now, we also have multiple working groups. Dr. Apley and several other researchers are very involved and a research working group trying to identify some better ways to have some better data and better answers about the topic of antibiotic resistance. But then also working groups consisting of producers and veterinarians that want to help us as an association figure out where our policies need to be when we're working with the federal agencies like the FDA, and then also our efforts up on Capitol Hill to educate members of Congress and their staff about what we do in the industry to raise healthy animals beyond the use of antibiotics.
Kristina, this spring, Representative Rosa DeLauro introduced HEAL, okay, Helping Effective Antibiotics Last, an act, okay, a piece of legislation. And Representative Louise Slaughter once again introduced the PAMTA, or the Preservation of Antibiotics for Medical Treatment Act. What are these two pieces of legislation trying to do? And what do you think Congress will do with these pieces of legislation?
So the ideas put forward in both these individual legislative bills moving forward or just being discussed in Congress is something that happens on a pretty continual basis. So from my 7 years of being here at NCBA, every session, Louise Slaughter from upstate New York introduces legislation known as PAMTA or similar legislation that's PAMTA-like. There's also Congresswoman Rosa DeLauro from upstate Connecticut who also introduces legislation just about every session on antibiotics. And really, when you start looking at the committees of jurisdiction here in Washington, a lot of people think that it's the House and the Senate Agriculture committees. Even though those committees play a role, because that is our main jurisdictional committee, this jurisdiction actually falls to the Food and Drug Administration. So in the House, that's the House Energy and Commerce Committee. And on the Senate side, that's the Health, Education, Labor, and Pension Committee. So when you start looking at those two committees, the Energy and Commerce Committee of the House and the Senate Health, Education, Labor, and Pension Committee, there's some pretty big priority issues that they're working forward to right now. These legislative items don't actually fall on that list for what the committee wants to move forward on for this congressional election year. So we feel pretty confident that our efforts on Capitol Hill with educating members of Congress and their staff about how we use technologies like antibiotics and really just helping them become more aware of food production from the beef cattle perspective and really what that looks like has been instrumental in just helping build education and awareness around these topics. I do think that these two members of Congress, as well as maybe a handful of others, will continually introduce legislation to try to move the dialogue or move the conversation forward. Our biggest criticism would be that the science that they're actually basing this legislation on, in our definition and opinion, is not sound science. It's not data that's ever been peer-reviewed or published in a scientific journal. And we've always had an open invitation to say, if you truly want to talk about antibiotic resistance and what this truly means, let's bring all stakeholders to the table and have this discussion, not just the livestock or the food animal production group, but have us sit down with the medical community, the human health doctors, and let's actually have a full-hearted conversation. But don't bring a study of the day that's never been peer-reviewed or published in a scientific journal and bring that to Washington and try to move policy that's not based on sound science. That's not something the beef industry or NCBA is going to be able to support.
Dr. Apley, in December 2013, the Food and Drug Administration, or FDA, proposed two guidance for industry documents, GFI 209 and GFI 213. Can you tell our listeners what these two documents are and what they're trying to accomplish?
Guidance 209 said two key things, and it's put forth as a voluntary compliance document. It's not with the force of law or regulation, but it does ask for voluntary compliance, which has been achieved with the companies that own the approvals for these products. The first thing Guidance 209 said is that the FDA no longer considers the use of medically important antibiotics, those antibiotics which also have a place in human medicine. They no longer consider the use of these for growth promotion in food animals to be judicious. The second part of that document says all feed-grade antibiotics, which are medically important to humans, should be used only under the guidance of a veterinarian. And this would be through a veterinary feed directive in the feed, and they also included the water use of antibiotics that are medically important for humans, and that would require a prescription. Our producers will still be able to purchase these drugs if they are authorized by a veterinarian for use in the feed, but it will require a veterinary feed directive, and that is only going to be able to be provided within the context of a veterinary client-patient relationship. And that VCPR will be defined by the states, and if not defined by a state, it will be defined by the FDA. It will require that the veterinarian authorizing the use of these antibiotics will have knowledge of the producer's operation, will be available for follow-up. There's some other basic requirements, but that's the gist of it. So Guidance 213, the second document, is the roadmap for achieving the goals of Guidance 209. There were approximately 283 products and 25 companies affected by this, and all have agreed that they will abide by this request by the FDA. So we're looking at that taking effect as of January 1, 2017. Our producers can expect to be required to work with their veterinarian in order to use any antibiotics that are medically important in the feed or in the water. And it's important to understand that one key exclusion from that is a group called the ionophores, which our producers would know as Rumensin or Bovatec, and these will not require the BFD.
So, Dr. Apley, are you saying, let's make sure that our listeners understand what the term judicious use really means and what medically important really means, okay? Because I think those are two key things out of the 209 and 213 documents that kind of drive this.
Sure. The judicious use is a term that can be defined by the FDA and isn't defined in regulations. If they would have used the term hazard in the document, there's a certain regulatory cascade that would need to be followed. But the term judicious, by their definition, does not include the use of these medically important antibiotics for growth promotion, but it does include the use for prevention, control, or therapy of the disease.
Okay.
Medically important means those that are used in human medicine also, and it's a class association. So examples of medically important antibiotics are the tetracyclines, the macrolides, phenocols, those types of drugs, which the veterinarian can help you with the trade names on those. But they are classified based on human doctors, medical doctors, defining exactly which ones are important for human health.
Okay. So are there any feed grade you mentioned the ionophores, okay? Are there other feed grade products that we might be able to feed in the industry that do not fall under the jurisdiction of 209 and 213?
For beef cattle, besides the ionophores, there's another group called the bambermycins, flavomycin, trade name is GainPro. There's also BMD, bacitracin, which has some claims in cattle as well as swine. There are two drugs in swine, tiamulin, and then one also called Carbadox or Mecadox. And those are the main ones right now that are outside of that classification.
Okay.
Kristina, how does GFI 209 and 213 affect over-the-counter products? You know, I know there's a lot of discussion about how livestock producers historically in the past have just been able to go to the feed store or the co-op and buy antibiotics that they need to treat their cattle. Will they continue to be able to do that, or do you think at some point in time will all antibiotics come under veterinarian's prescription?
Well, when specific to the VFD and Guidance 209 that Dr. Apley just referenced, that is just specific to in-feed and water uses of those antibiotics that are critically important in human medicine. So that doesn't have an impact on the over-the-counter medications. But however, over this last year, in our conversations with the Food and Drug Administration, just generally, they continue to talk about their definition of judicious use, which Dr. Apley also referenced. So these have been conversations that have been occurring through NCBA's Cattle Health and Wellbeing Committee meeting, where we've had individuals like Dr. Apley and a few other veterinarians and researchers actually come and start talking about how the industry needs to start talking about some of these technologies, these products, the relationship with their veterinarians, because moving forward, there is interest here in Washington to further define what judicious use looks like, and then also from the Food and Drug Administration's perspective to also define what that vet-patient relationship looks like. So it's not going to currently be impacted by the guidance documents that are put forward that come into effect at the end of 2016, but it is a conversation that we continue to hear in Washington, with the agency continually wanting to have more information and be able to further really define what judicious use looks like, and then what that relationship looks like between producers and their veterinarians, really at all sectors and segments of the beef industry. So it's still an area of interest for us. We're very engaged in that at several levels. I'm sure there's going to be conversations coming up next week at NCBA's summer meeting when we do have Dr. Apley and a few others come to that committee meeting and talk about antibiotics and all the recent conversations, not only here in Washington, but also throughout the industry.
So at the moment anyway, over-the-counter injectable antibiotics are still available. Is that right?
That's exactly right. They're not going to be impacted by the guidance document that's moved forward at this time.
Okay, thanks. This is a question I'm going to throw at both of you. There are a number of beef production systems that don't use antibiotics. Some retail markets and restaurant chains have jumped onto that bandwagon, and certainly the animal activist groups are promoting the idea of having all antibiotics removed from livestock production systems. Dr. Apley, if that happens, if cattle producers are restricted in their ability to use antibiotics, how is that going to affect animal welfare and animal well-being?
Bert, I think there's sure room for us to evaluate uses, and there's always room for improvement. I think I'll give you my personal approach to that is that refinement, some reduction is okay, none is not an option. We can raise some of the animals without antibiotics. I think that trying to raise them all without an antibiotic, in my opinion, is not how I would practice veterinary medicine. I think that the inability to treat an animal with a foot rot right now when it's rainy, even out in pastures here in the Midwest with the rain we've gotten, we've had a lot of issues with that. The ability to prevent clinical cases of anaplasmosis in the fall in cow herds, a disease for which we don't have a good federally licensed vaccine. There are some very critical uses that I feel would have a negative impact on animal welfare if we're not able to treat the animals. So I do think we can look at our uses. I think we are. Kristina mentioned a working group we have within the NCBA. We're also doing that within other food animal species groups. We're doing that within veterinary groups, and it's being addressed. And it comes down to the term stewardship, which incorporates our desire to find alternatives to antibiotics. But when we do need to use them, we use ones that are shown to be safe and effective. We use them under a veterinarian supervision, and we continue the search for alternatives.
Okay, good. Kristina, as we mentioned earlier, this has been an issue in the media for many years. How does the beef industry, how do we as beef producers avoid losing the perception war?
Well, I think the first thing that we need to do as an industry is figure out a way to talk about science to a non-scientific audience. And we've taken this approach multiple times here in Washington just to help educate members of Congress and their staff, who quite frankly, most of which don't come from an ag background. That's not necessarily a bad thing. It's an opportunity for the beef industry to help them understand what we do and why we use these technologies like antibiotics and under what conditions and situations. I think it's really important for our producers, and we've had many start using social media to their advantage to talk about what they do to raise healthy cattle and how antibiotics are one of many tools in their toolbox to help achieve that. I think it's also important to just be aware of what consumers are hearing and what their concerns are, and then as an industry to be transparent in helping address some of those concerns. And sometimes that answer might be, that's a good question. We don't have the answer for you, or we don't have the data to provide that to you at this time. But let's keep the dialogue ongoing and continuing. And as research prevails and as we find that data, let's continue those conversations and that dialogue. So really it's about knowing where our consumers' concerns come from, the science that's there to help them understand how safe our product truly is. When you start thinking about everything that goes into raising a beef animal and how a beef animal is different from other livestock or protein sectors, and really just trying to help relate to them from where they are and then make it relatable to the information that is helpful for them, that's a concern for them, but then also have the science as an industry to help them feel comfortable with the products that they're consuming.
Dr. Apley, as we kind of round up this session on antibiotic resistance, what would you say would be the take-home message for producers?
I think the real take-home message is, while there's going to be changes, we're still going to have access to very useful tools to help prevent, control, and treat infectious disease in food animals. This is going to require increased communication and interaction with veterinarians in the form of a veterinary client-patient relationship. Personally, I think this is going to be a great addition to production and maybe bring some of those interactions more frequently to places they may not have been before. We will still have the tools. As Kristina mentioned, our transparency in the industry is going to increase. I think we will have some type of antibiotic use reporting over the next 3 to 5 years that's going to put us in more of a spotlight. I think we can be proud of how we raise animals. I think we can continue to improve, and I know the veterinary profession is looking forward to working with producers to get this done.
Kristina, what would you say the take-home message is for our consumers?
Well, consumers need to be confident about the beef products that they have available to them today. And really, we are the powerhouse in the U.S. cattle industry when it comes to having such a diverse product for our consumers, for the different types of marketing programs that the industry has evolved with. And really, there's a lot of choice in the retail case here in the United States that's not available in other countries. So I think for them to understand that consumers are listened to by the industry responds with putting those products in the retail case that consumers want to purchase. But it's also about choice, and have the confidence with no matter what choice of beef product they're purchasing, whether it's a never ever program on antibiotics, whether it's a more conventionally raised program and a product available in that retail case, that there are safety provisions put in place that meet the highest expectations, not only here in the United States, but globally. So it is a safe, wholesome, and nutritious product that they can feel proud about feeding themselves and their family. And for anybody that has questions or wants additional information, there's a great resource that the Beef Checkoff has put forward called factsaboutbeef.org, where they can find a lot of information out about the currently regulatory programs in place and just in general how producers raise different production practices of the cattle and the beef products that they supply in the retail case today.
Thank you.
Well, that about wraps up our inaugural edition of the Beef Roundtable.
We'd like to thank our guest, Kristina Butts, the Executive Director of Legislative Affairs for the National Cattlemen's Beef Association, and Dr. Mike Apley, Professor of Production Medicine and Clinical Pharmacology from Kansas State University, for being our guest.
The Beef Roundtable is a joint production of Beef Magazine and Purdue University Department of Animal Sciences. The Beef Roundtable will be available on Beef Magazine website, iTunes, our YouTube page, as well as at www.beefroundtable.com. We really want to hear your comments, and they can be submitted on the comments portion of the website.
Please join us again next month when our Beef Roundtable discussion topic will be Waters of the United States, or WATUS, and what it means to the beef producers. It should be a great discussion. Until next time, Bert and I would like to thank you for joining us, and have a safe and rewarding month.